Alright, once again, this is Dr. Ed. We are going to look at the second part of the abdominal scanning protocol. Hopefully you watched part 1, which was presenting the liver and the gallbladder ultrasonography. And so today we are going to look at abdominal great vessels, the pancreas and the spleen. You know, with a protocol it is better if you follow order, and so if you haven't watched part 1, please go start with part 1 then come to part 2 so that you understand everything. Alright, so we're going to start with abdominal great vessels. We can see the abdominal iota all the way from the diaphragm up to the level of its bifurcation into common iliac arteries. Still, we can see the inferior vena cava still from its cavo aperture up to the level of the common iliac veins. So these are the tributaries, whereas the aorta has these branches, which we are going to see in details. Okay, still on this sonogram, we can see the inferior vena cava, and then we can see the abdominal aorta with these branches, whereas we can see this tributary from the liver. Most likely this is hepatic vein. Alright, so we are going to start with the abdominal aorta. As you know that structures we have to scan in both sagittal and transverse. So this is a sagittal view of the abdominal aorta, showing these two main branches, the celiac trunk and the superior mesenteric artery. So for the aorta, we know that it is a tubular straight structure with thick walls, which are echogenic, hyperechoic. Then posterior, it lies posterior to the liver. We can see this is the liver, so it is posterior to the liver. When you're scanning from the midline, it lies slightly to the left of the spine, so it is incompressible, doesn't vary with respirations, it is pulsatile, and when you go to a transverse image, it appears as a circular anechoic structure. So measurements, it measures mostly before giving these branches, it measures 3 centimeters and less. So before or after giving up or giving out these anterior branches. So after it measures 2.5 centimeters, whereas immediately before it bifurcates into the common iliac arteries, it measures around 2.0 centimeters. So in this sonogram, we can see this is the celiac trunk, which goes and gives out to hepatic artery and splenic artery. Whereas this image, you can see the aorta giving out to the right renal artery and the left renal artery. Alright, whereas this hyperechogenic walled structure is the superior mesenteric artery. For these other structures, we shall see as we continue. Alright, so with the aorta still, we can see the tubular structure reaching at this level, then giving out to these two branches. So this is the aorta bifurcating into the left and right common iliac arteries. Okay, so before bifurcating, that measurement is taken at this level, which shouldn't exceed 2.0 centimeters. Alright, so what of the inferior vena cava? So in sagittal, this is how it appears. It is hammock shaped. Here we can see when it's curving to power into the right atrium, whereas it traverses through the liver. So we shall have part of the liver lying anteriorly, whereas some part of the liver lying posterior to it. The walls are thinner compared to the aorta and less echogenic. So with respirations there is some variation, then it can be compressed on real-time scanning. So it has tributaries, which are the first ones being the hepatic veins. Then it appears oval on transverse view. So these are the hepatic veins entering to the IVC or joining the IVC. Then here we can see the IVC appearing oval. Okay, so this is the portal confluence, which is given by vessels, the splenic vein.